Now I request Dr. Lakshmi C to present her paper, please.
Good morning. I'll be presenting my paper of perspectives of stakeholders regarding assessment and treatment of refractive error and amblyopia in preschool children of Kozhikode district. It's a purely qualitative study. The context is WHO has taken a great initiative in pediatric eye care. And but the thing is, in India, there is a national consensus statement which states that all the international standards is difficult to be implemented because of limited resources. And if we look at the literacy states of different states, it's different. And the health indices are also different. Kerala has a high literacy state. And even in Kerala, there has been a recent study in 2023 where disability due to preventable causes is very high, as high as 50%. So we decided to do a qualitative study and to go into the community and assess the regional differences, traditional practices, so that we could come up with customized screening programs and most probably bridge the gap between the research and the policy making. The aim of the study was to study the awareness and perspectives of stakeholders regarding refractive error and amblyopia in preschool children. The first objective was same, and the second was to identify the barriers faced by the stakeholders. It was a purely community-based qualitative study in the rural field practice area of tertiary care center in North Kerala for a period of 2 months. And all the stakeholders, the parents of preschool children in the rural field practice area, Anganwadi workers, healthcare workers, including the pediatrician, pediatric ophthalmologist, general ophthalmologist, an optometrist, health inspector, and a medical social worker were included. We collected the data mainly by 2 methods. First was a focus group discussion, and the second was a key informant in-depth interview. The focus group discussion was conducted in 2 groups of parents of preschool children and among the field level healthcare workers. The key informant interview was from a pediatrician, general ophthalmologist, pediatric ophthalmologist, and an optometrist. We did interviews with a principal investigator and a note taker, and along with a sociogram drawing to ensure good discussion with an audio recording. We used an open-ended thematic topic guide to assess these interviews. These interviews were transcribed, and then a thematic analysis with inductive approach was adopted. We had 3 investigators discussing and deriving codes from these interviews. These codes were summed up into categories, and the categories into mainly 3 themes. So these were our results. The 3 themes were the perspectives regarding the barriers, the perspectives on the attitude of the community, and possible potential policy changing facilitators perceived by these participants. The perceived barriers were lack of information, education, communication activities at various stakeholder levels, practical difficulties like shortage of trained optometrist, symptom-based health-seeking behavior, and amblyopia being a very difficult concept to understand. And there are no streamlined screening programs in preschool children. The attitude of the community, it was surprising to see that social stigma, financial barriers, and access to healthcare was not perceived by these participants as an important barrier. But the government programs were very well accepted, and they knew very well the role of field-level health workers like Anganwadi workers and ASHA workers. And they did not prefer alternative medicine in our participants. So the policy changing things that they felt were dissemination of information, especially with associations like associations of ophthalmologists and pediatricians, may have an important role according to the doctors. According to the parents, the timing, site, and personnel who give the information was important. They preferred these sites for information imparting. And medium and content of information, they preferred YouTube shorts as the most acceptable method. Government circulars were also accepted, and children educating cartoons were also suggested. And upskilling of stakeholders was an important thing that all of the healthcare workers needed. And the pediatrician even suggested the inclusion of preschool health be included in the MBBS curriculum. Screening programs, all of them requested that they needed IEC activities along with the screening program and involvement of the field level workers. So these were the important verbatim comments that we got from the qualitative assessment. So while discussing implementation of international guidelines, it might be difficult in a national basis because we have a very diverse society. So should we take a different approach in Kerala, or should we have a state-wise different approach in policy making? Because in most of the South Indian studies, financial distance and social factors were the main barriers, whereas in our basic interview, we felt that that is not a very significant thing. So this could be an indicator of regional differences because of maybe literacy rate or any other differences. And national consensus has also suggested universal immunization program linked vision screening programs, and role of preschool teachers in assessing preschool vision has been found to be an effective method which has been studied extensively in Malaysia. Screening with photo screeners are also being done in many places, and from insights from our study, our people are very well aware of the government programs. They know the level of work that the field workers are doing, and they are also highly literate. So since we have these insights from this small study, qualitative study, there is a need for structured preschool vision screening along with that awareness program. So what our study adds is, even though the other studies compare access to medical health as a big barrier, knowledge gap is the barrier that we felt. And the discussions impart that IEC activities are very well accepted by our patients. So implementing policies rather than having a national policy, maybe a statewide policy with understanding the felt needs of the society might be the way to look forward. So that is our conclusion. These are my references, and this is the interview guide that we used. Thank you.
No, it's supposing because the previous paper by Dr. Elizabeth, she said there was one limitation, not a limitation, but the challenge for refractive error correction and all was, alternative medicine.
Yes,
So in
but
your-
we had a very small community. It was a qualitative analysis. We don't have a quantitative assessment, but
Study, you were just asking
yes,
questions and discussing.
we had focus group discussion among 3 groups,
True,
but
I understood that.
none
Yeah.
of them had that
but
thing.
supposing you were to intervene, then will you see that reflection of people
Could be.
going in for alternative medicine?
But the preschool age, that they actually mentioned. Preschool age, they don't prefer alternative medicine. But when the child is slightly older, they don't mind.
Yeah,
That
so
is
once you, because all was, you were comparing in the last, I think last 2 slides but one, you were comparing intervention versus non-intervention. Yours was non-intervention. It was a questionnaire based survey and a focus group.
Not a
But-
questionnaire.
Yeah, I mean,
yeah,
it was
so,
an
yeah,
observation
observation
study, but
yes.
the comparator was actually intervention. When they intervened, then there was a you're not comparing head to head.
No, and like those are all national consensus
Correct.
statement, and the
After
other study
intervention has
was
been done.
no, those are all qualitative assessments of like how the process was done, like training and these things. No, I've not compared with the statistics of quantitative methods.
I think she just wants to say that knowledge probably will increasing the knowledge itself will
Yes,
increase
increasing the knowledge will bridge the gap
and what
rather
all
than doing
is
this quantitative.
acceptable as knowledge increasing thing, because as if people are not aware. As parents, I'm talking about, not the professionals.
Amblyopia is a very difficult
Very
concept for
difficult,
people to understand.
Once you start intervening, then you go for alternate.
Yes, that could be there. That could be there.
Everything will be like, because they're seeking knowledge from you.
Yes, that could be there. So, no, yeah, no, we mainly focused on screening
I
of
think instead
preschool
of
vision children,
fighting
not the
with that
individual.
alternative medicine, you should say, yeah, I continue that, but do what I'm telling also. We have had this whole Pondicherry exercise business for glasses